965 cases of COVID-19 reported in Indiana today and 20 deaths. The numbers have some healthcare workers concerned about what will happen this winter and if they should prepare for a surge. Our Alyssa Donovan explains how state leaders are handling the change and how they say stage 5 is not to blame.
The increase is a concern, especially for those who work in healthcare. State leaders say they're monitoring the numbers and will take action as needed. After a slowdown in cases this summer, doctors at Eskenazi Health have seen an uptick in COVID-19 patients.
In the last few weeks, we're starting to see some increases in the hospital, both in regular hospitalized patients needing extra oxygen, also patients who are critically ill in the ICU.
Dr. Christina Box says they're aware of increases in certain areas and have been checking with hospitals in the state to make sure they have supplies and beds.
Something that we've noticed and have already been addressing.
As of now, there's no shortage. Dr. Graham Carlos believes there are many factors impacting the change.
We've started opening things back up more and more. People are getting more comfortable going out and about and going to places where other people are. The schools definitely reopened, and as you know, we've seen cases.
Dr. Box and Governor Holcomb say the additional hospitalizations are not due to Indiana entering stage 5, noting that those hospitalized or counted as positive cases today likely contracted the virus 2 weeks ago while we were still in stage 4.5. The spread rate has also gone up from 0.94 to 1.1. Governor Holcomb addressed the increase today.
Doesn't mean that we go back to 4.5 or 4. It means we need to hunker down in the areas where we see spread.
But not all hospitals are experiencing a spike in patients. David Charles, an ICU nurse at Franciscan Health, says their numbers are still trending down.
We have a 30-bed adult ICU, and usually we have maybe 5 or 6 COVIDs. As opposed to 30, we were full during the peak back in April and May.
All healthcare workers are hopeful that any increase happening right now is not a sign of what's to come. I'm Alyssa Donovan, WRTV.